I mean, one of the things that I confess I was shocked to learn recently is that the United States is one of the countries in which maternal mortality has gone up in the last decade.
It's true. We're one of 8 countries where maternal mortality is increasing. And it had been coming down for many years, and then suddenly in the last 20 years or so, those rates are starting to climb. And people are most shocked. I mean, when I've showed my film around the world or when I talk about this issue in other countries, to learn that the U.S. is in this position is always an eye-opener. We lose 2 women per day in the United States, and half of those are also preventable. So, you know, there's a lot that can be done here too. I mean, access is not always the most obvious problem, but chronic health conditions such as diabetes and obesity, as well as hypertension and you know, race plays a role here in the U.S. in terms of women having access too. So it's something that we are also very focused on as an organization.
So access to quality prenatal care too.
Prenatal care is so essential. Globally, you know, the World Health Organization recommends that a woman should see a physician or midwife at least 3 or 4 times before they deliver in the developing world. Here, of course, as you know, we go monthly, then we go weekly, then there are so many times that you have that opportunity to ask questions, to check in, to see, to be able to identify complications before they arise. If a woman does not have access to that prenatal care, things can arise and we don't have the opportunity to be able to treat her, if it's eclampsia, for example, or you know, chronic diabetes or gestational diabetes. There are things that we can do along the line that can still put her in a safe place by the time she delivers. Imagine if you don't have those opportunities to check in with a skilled provider for the support, for the knowledge, for the link to a facility in the event that you need more emergency care. It's a terrifying experience. It's terrifying when everything goes right. It's still one of those things that is scary. It's amazing and it's frightening. But imagine when you don't have the support and the care that many of us here do.
So, Christy, you talked about the inspiration behind Every Mother Counts. Could you talk a little bit about kind of the work of Every Mother Counts?
Sure. Well, the organization is really an advocacy and education organization. You know, when I set it up, it was initially to provide education and options for everyday people to be able to engage in this issue. This is one of those issues that touches everybody once they know about it, and then the next step is usually, what can I do? So we're trying to provide those options for people because we believe that together, in partnership and with individuals, that we can make pregnancy and childbirth safe for every mother.